Good morning, CA1s. Today we're going to talk about the most important and quite potentially most dangerous part of your job, the induction of anesthesia. By now you've probably heard anesthesia compared to flying a plane. Going to sleep is like taking off, waking up is like landing. But for a while here, it's going to feel a lot more like flying a space shuttle. Today you should focus your studying on describing the process of inducing anesthesia, why we give the medications we do, and is there a reason to the order in which we give them, and think about why induction is considered the most dangerous part of anesthesia. Your second objective should focus on learning the techniques by which we induce anesthesia. As a hint, think about the various agents that we give and how they're delivered. In which situations would you use one technique over the other? The other thing you'll learn about today is patient assessment. Specifically, how can you objectively gauge the depth of anesthesia? How do you know that your patient isn't going to have awareness or react to the stimulus of intubation? Your fourth objective is probably the most involved and will take the most time. You should review the pharmacology, kinetics, dynamics, and uses of common induction agents while focusing mainly on benzodiazepines, propofol, ketamine, and etomidate. There are some useful resources listed at the end of this video to help you. For your last objective, you'll consider the most common adverse reactions associated with each of the most common induction agents I mentioned on the previous slide. You should also, while you're studying, consider patient populations and situations that would prompt you to use or not use each of those agents. As always, here are some additional resources to aid your studying. The Faust chapters are great. There's a chapter for each induction agent, and the ACRAC podcast on induction agents is particularly good on this subject, so I would recommend it if you have time.